Hello friends, I am Dr. Dinesh Kumar Mishra, Professor Pharmaceutics, College of Pharmacy, IPS Academy, Indore. Today in this episode, we are going to talk about an important title, Semi-Solid dosage forms. We will start with the general introduction of the topic, followed by ideal properties of semi-solid dosage forms, skin structure and function, mechanism of drug penetration through skin, factors influencing penetration through skin. So let's begin our today's episode with introduction of this topic. What are these dosage forms? These dosage forms are topical dosage forms intended for external application on the skin to provide local or systemic effect. They may also be used for protective or cosmetic purposes. As name indicates, it is neither completely solid nor liquid, rather exists as partial solid and liquid. Semi-solid dosage forms are traditionally used for treatment of topical ailments. Drugs like antibacterials, antifungals and antivirals are included into these products, which demonstrate their activity on the tissues, surface layers or penetrate into internal layer to accomplish the site of action. These dosage forms constitute a noteworthy quantity of pharmaceutical dosage forms. Drugs that are delivered topically through skin, cornea, rectal tissue, nasal mucosa, vagina, buccal tissue, urethral membrane and external ear lining. These dosage forms serve as carrier. Now, what are the merits possessed by these dosage forms? They are convenient to the patients, the easy compounding is possible, they can be easily applied, so easy application, and they cause the avoidance of first pass metabolism, and they are readily available for the absorption. But in spite of several merits, they possess certain demerits. They may cause skin irritation, chances of variation in barrier function from person to person and also within the same person. There is no accuracy in dose measurement, and cost of the product is also high in the semi-solid dosage form. Now, to know better about semi-solid dosage forms, it is important to get acquainted with following aspects like ideal properties of semi-solid dosage forms, types of semi-solid dosage forms, skin structure and function, mechanism of drug penetration through skin, and factors affecting penetration. What are the ideal properties? Physical properties like smooth texture, elegant appearance, non-dehydrating, non-gritty, non-greasy and non-staining, non-hygroscopic. Now come to the physiological properties. They are non-irritating, miscible with skin secretion, low sensitization effect, do not alter membrane or skin function, and the easy application with efficient release of drug and high aqueous washability. Now come to types of semi-solid dosage forms. You can see there are ointments, paste, cream, jellies, gels, poultices, plasters and suppositories. Let's start discussing one by one. First, ointments. What are ointments? Ointments are semi-solid preparations for external application to skin or mucous membranes containing medicament. Medicament may be solution, suspension or emulsified in the base. Their composition softens but does not melt upon application to the skin. Ointments usually exhibit plastic flow characteristics. Therapeutically, ointment function as skin protectives and emollient, but they are used primarily as vehicles for the topical application of drug substances. Now, talk about creams. What are creams? Creams are nothing but they are semi-solid emulsions containing suspensions or solutions of medicinal agents for external application. They usually show pseudoplastic flow properties. Presently, creams are soft, easy to apply and cool the skin. After creams, we will talk about gels. What are gels? Gels are type of semi-solid dosage forms that contain either suspensions of small inorganic particles or large organic molecules interpenetrated by a liquid. Now, what are paste? Paste are semi-solid dosage forms that consist of one or more active substances incorporated in a base with large proportions of finely dispersed solids. They are different from ointments and creams as they show dilatant flow due to presence of high concentration of insoluble medicament. After these paste, we will talk about poultices. They are soft, viscous, pasty type of preparation Used for external application, it should retain heat for considerable time as these are intended to supply warmth to the inflamed parts of the body. These act by increasing the blood flow, thereby relaxing tense muscles and soothing inflamed tissues or drying toxins from an infected area. Consequently, they can be used to relieve the pain and inflammation associated with the abscesses. Example, Keolin poultices. Now, after this, we talk about plasters. What are plasters? They are solid or semi-solid masses made by incorporating medicaments in resinous or waxy bases, which are melted and spread over suitable backing material. They are mainly applied to provide protection and mechanical support, bring medication into close contact with the skin surfaces. Now, we will talk about suppositories. What are suppositories? They are solid or semi-solid dosage forms usually medicated for insertion into the body cavities. What these body cavities like rectum, so they are known as rectal suppositories, vagina, that's why they are known as vaginal suppositories, or urethra, urethral suppositories, where it dissolves or melts and is absorbed into the bloodstream. They are used to deliver both systemically and locally acting medications. After suppositories, we will talk about jellies. What are jellies? They are transparent or translucent, non-greasy semi-solid and contain more water than gels. These are used as lubricant for surgical globes, catheters and rectal thermometers. Therapeutic jellies, they are used for contraceptive purposes, which contain surface active agents to enhance the spermicidal properties of the jelly. As in module 2 we have discussed types of dosage forms, come to module 3 that contains skin structure and function. In order to solve any query regarding the therapeutic and cosmetic uses of myriad dermatological fabrication available, a pharmacist must be well aware about the anatomical structure as well as functions of the skins. So let's talk about what are the skin functions. Protection from harmful external stimuli or barrier functions. Barrier functions, it may act as a microbial barrier, chemical barrier, radiation barrier, thermal barrier, electrical barrier. It also causes the regulation of body temperature, regulation of blood pressure, synthesis and metabolism, containment of body fluids and tissues, and it causes the biochemical based disposal and reception of external stimuli like pressure, pain or thermal. Now, after functions of skin, we will talk about structure of skin. The skin is the largest organ of the body, accounting for more than 10% of total body mass, weighs an average of 4 kg and it covers nearly area of 2 meters square. The skin is divided into 3 major layers: epidermis, dermis and subcutaneous tissue. Now, what is epidermis? This epidermis is the outermost layer of the skin and having approximately 150 micrometer thickness. It is composed of 4 strata: the stratum germinativum, that is also known as basal layer, the stratum granulosum, the Malphian layer, or the stratum lucidum, also known as granular layer, and the stratum corneum, also known as the horny layer. The stratum corneum, that is heterogeneous outermost layer of the epidermis and is approximately 10 to 20 micrometer thick. Within the epidermis, there are 2 distinct types of cells, the keratinocytes and the dendritic cells. The surface lipid film and the stratum corneum form the interface with the environment and as such provide the site for the topical application of medication. After epidermis, what is dermis? The dermis interfaces with the epidermis. At the epidermal-dermal junction, it is 10 to 40 times thicker than the epidermis. Depending on the area of the body, the dermis is metabolically less active than the epidermis. It is a matrix of loose connective tissue composed of polysaccharides and protein. This matrix contains nerves, blood vessels, hair follicles, sebaceous and sweat glands, mast cells, macrophages, melanocytes, leukocytes and endothelial cells of the blood vessels are also located in the dermis. The function of the dermis is to nourish the epidermis and anchor it to the subcutaneous tissue. Now, what is this subcutaneous tissue? What is this subcutaneous tissue? This serves as a receptacle for the formation and storage of fat. The subcutaneous fat functions as both heat regulator and shock absorber. This is the place for dynamic lipid metabolism and supports the nerve and blood vessels that pass to the dermis. The deeper hair follicles and sweat glands originate in this layer. After this structure of skin, we will talk about module 4. Before moving to our next module about mechanism of drug penetration through skin, I would like to suggest you to visit our website, that is www.cec.nic.in, for further reading and learning of more topics associated with your B.Pharm syllabus. Here you will find many lectures, e-content, frequently asked questions, LORs and many more. Hope this site will be a catalyst of learning for you. Now coming to mechanism of drug penetration through skin. What is the mechanism of drug penetration through skin? Drug penetration through skin involves mainly two pathways. First is epidermal route, second one is transfollicular absorption. Choice of pathway that is influenced by drugs, physicochemical properties as well as nature of the formulation. So now we start with the first route, that is epidermal route. For drugs which mainly cross intact horny layer, two potential microroutes of entry exist. First one is transcellular, also known as intracellular route, and second one is paracellular, also known as intercellular route, and we will talk about now transcellular route. Now what is the role of hair follicles? Hair follicles with their associated sebaceous glands are present all over the skin surface with the exception of lips, palms and soles. Furthermore, hair follicles intersperse down to the subcutaneous, offering permeation pathways deep into the skin. The density of hair follicles varies with species and body site. The sebaceous glands produce the sebum, which lubricates and protects the skin and is involved in the regulation of the pH on the skin surface. What are the various factors? First one is physiology and skin pathology. First one is skin condition. Skin physiology mainly concern with skin function and skin appendages. Processes like skin response, permeation and perspiration are much dependent on skin physiology and its pathological conditions. Disease of the skin and any injury to the skin causes the rupturing of the lipid layers of the stratum corneum, which alters the skin penetration of drugs. Second one is skin hydration. Hydration of the skin causes the swelling of the stratum corneum and provides some fluidity to the skin. It also boosts the permanent solubility and partitioning from vehicle to the membrane so that permeation of drug molecules occurs easily through the hydrated skin. Third one is skin age. Permeability of skin varies with age, as in case of skin of young and elderly are more permeable than middle-aged persons. Premature newborn shows absence of stratum corneum and children are more liable to toxic effects of drugs through the skin. Next one is blood flow. An increase in blood flow amplify the concentration gradient across the skin, thereby lessen the residential time applied formulation, whereas alteration in peripheral circulation do not affect transdermal absorption. Next one is skin temperature. It also affects percutaneous absorption of the applied formulation increases with the increase in skin temperature due to fluidization of lipids and vasodilation of the blood vessels which are in contact with the skin. Next one is reservoir effect of horny layer. The passive diffusion is the most important mechanism by which the formulation is absorbed through the skin. Thus, if high concentration of diffusive substances is present on the skin as compared to the inside of the skin, so these molecules diffuse from reservoir to maintain concentration gradient. Next one is species variation. It is now very obvious that skin permeability varies between species. For example, rabbit skin is more permeable than that of the guinea pig, whereas human skin is less permeable than both the species. So this is a factor which must be considered during formulation development of semi-solid preparations. Next one is lipid film. This skin is made of lipid bilayer, so for better absorption, formulating agents should have some lipid solubility, but at the same time, it should have some hydrophilicity to diffuse inside the skin in aqueous environment. Second major factor is physicochemical properties of the drug. How drug properties affect? First one is drug molecular characteristics. Size of drug candidates has inverse relation with the penetration through the skin. It means the greater the molecular weight, smaller will be the absorption. The drug candidates larger than the 500 Dalton are impermeable through the skin. Second one is drug concentration. The absorption of drugs through the skin is governed by passive diffusion. Drug transports according to concentration gradient, that means from high concentration to lower concentration. So the concentration of drug in the formulation applied over the skin determines the diffusion rate across the skin. Higher the concentration, more will be the permeation. Third one is solubility in partition coefficient. Drugs are either hydrophilic or lipophilic in nature. The partition coefficient determines the solubility or diffusion of drug in lipids and aqueous systems. Drugs possessing both lipid and water solubility are suitable for percutaneous absorption, as skin is made of lipid bilayer, so drug having high lipid solubility will absorb faster. Conversely, it should also have hydrophilicity to diffuse inside the skin in hydrophilic environment. Next one is polymorphism. This polymorphism, the metastable polymorph is much more soluble than its stable form. Hence, the drug release in metastable state is greater than stable form. Third one is vehicle effect. In vehicle effect, first one is pH. Most of the drugs are either acidic or basic in nature. Hence, the pH of the vehicles determines its ionization at skin surface. Unionized drugs or species have better absorption than ionic species. So, extent of drug penetration is better determined by pH. Second one is volatility. The compounds which are relatively volatile possess good lipid solubility and slight water solubility enables them to pass rapidly through the skin. Next one is additives effect. In additive effects, first effect will be the surfactants. What are these surfactants? Surfactants are very commonly used as emulsifiers in formulations for transdermal delivery. It contains both lipophilic and hydrophilic component. Surfactant diffuses in water and gets adsorbed at interfaces between water and air or between water and oil. Where water is mixed with oil, they have the ability to solubilize lipids within the stratum corneum. Second effect is humectants. What are these humectants? They are also known as moisturizers. They are important ingredients allowing preventing loss of moisture, thereby retaining the skin's natural moisture. Some compounds also have the ability to actively attract moisture. Third one is penetration enhancers. These are very important agents. These agents may cause diminished barrier function due to stratum corneum lipid fluidization and hence increase the activity of drug in vehicle and skin. Now, next effect of penetration enhancers. These are very important agents. They may cause diminished barrier function due to stratum corneum lipid fluidization and hence increase the activity of drug in vehicle and skin. So, now we have seen the important aspects of the semi-solid dosage forms. Now, we are going to summarize our modules. In summary, these are semi-solid preparations that may be used for skin protectants, emollient, lubricants or active drug delivery. These preparations are easy to apply, convenient to the patients, avoid fast-pass metabolism and readily available for absorption. In spite of numerous benefits, they may have few limitations like skin irritation, inaccuracy of dose, etc. These preparations must have specific properties related to its appearance, texture, skin irritation, skin sensitization and application. Their common property is the ability to cling to the surface of application for reasonable duration before they are washed or worn off. This adhesion is due to their plastic rheological behavior, which allows the semi-solids to retain their shape and cling as a film until acted upon by an outside force, in which case they deform and flow. Semi-solid dosage forms can be classified into various types, including ointments, creams, paste, gels, jellies, plasters, suppositories. These formulations are mainly applied to the skin, where they usually serve as vehicles for topically applied drugs. A lesser portion of topical semi-solid dosage forms are applied to mucous membranes such as rectal tissue, buccal tissue, vaginal mucosa, urethral membrane, external ear lining, nasal mucosa and cornea. Percutaneous drug absorption involves passive diffusion through the skin. It involves passage through the epidermis, results from direct penetration through the stratum corneum, followed by passing through the epidermal tissues and into the dermis. There are numerous factors that influence the drug penetration through skin. It includes skin structure, drug physiochemical properties, vehicle, skin hydration, skin condition, etc. In summary, this module will help students to understand about semi-solids and their properties, types of semi-solid dosage forms, its skin structure and function, drug penetration through skin, factors affecting drug penetration through skin. We will be back with another episode discussing further about these semi-solid dosage forms. So do keep in mind what we discussed today for the continuity of the topic. Time for you to self-study. If you want to learn more and enhance your knowledge, so you please log on to our website for MCQ, quiz, LORs. That site is www.cec.nic.in. Till then, keep studying. Goodbye. Thank you.